neighbor, my state, Montana, someone worked with many subjects, and also on the one of the group of six. And I might say for everybody here, Senator, that during those meetings, you really forced us to drill down deeper by asking more precise questions. How does this work? How does that work? What about this and what about that? And I don't know, sometimes I looked at you, I think maybe that's because you were once a CPA. You probably still do practice a bit, but you were very valuable by forcing second, third level of analysis. Good job.
Well, thank you, and I do appreciate you calling it the group of six rather than the gang of six, because my mom told me never to join a gang. And I want to thank you for your tremendous efforts on this issue. I think it's unprecedented, and I'll talk more about that in a few minutes. First, I want to briefly discuss some of the key issues in the bill and what it will mean for every American. I do think every American should have the right to choose the health care benefits that best meet their needs. Now, this bill does still mandate a level of benefits that will significantly increase the costs of many insurance plans being sold in Wyoming and many other states across the country. I believe that every American should have the choice to buy a lower-cost health plan that covers basic services and offers catastrophic protections. Individuals should also never be compelled to enroll in a government-run plan. This bill would enroll everyone with incomes below 100% of poverty in Medicaid. Over 40% of the nation's doctors now refuse to see Medicaid patients. But this would be the only health care option under this bill for 11 million working-class Americans. The expansion of Medicaid in this bill directly contradicts the goal stated in the President's recent speech of providing increased choice and competition in our health care system. I believe every American should have the right to choose to enroll in private health insurance coverage. We also need to reduce health care costs for individuals. This bill does not do enough to lower costs, and in many cases, it'll actually increase the costs of health care through new taxes and mandates. I believe that health care reform legislation must address fundamental issues like medical liability reforms, as Senator Carper mentioned, providing financial incentives to adopt healthy behaviors, as Senator Carper mentioned, modifying our tax code to encourage more rational choices about employer health insurance, and eliminating new taxes that will only drive up the prices patients pay for health care. Medicare savings should also go to strengthen the Medicare program. This bill cuts billions from the Medicare program and then spends the money to cover the uninsured. Medicare's physicians' fees will be cut by 25% in 2011 and an additional 5% per year for the next 8 years. Medicare also provides no protections to its beneficiaries against catastrophic costs. The President promised everyone to be covered for catastrophic. I believe that we can do better and that any savings from the Medicare program should be used to strengthen and improve the Medicare program. As with Medicaid, if you can't see a doctor, you don't have health care. Now, today we're going to be marking up this, which is a 220-page summary. This isn't all of the legislative language, which would be many times that big. But I have noted that we have 2 volumes of amendments, 564 amendments, to try and change that. And I would mention that these are in summary form as well. Now, we have talked about the need for senators to read bills and to have the actual language, because sometimes the devil's in the details. So now I've outlined some of the significant problems, but I'd also like to commend the leadership of Chairman Baucus, who has worked with Ranking Member Grassley and other Republicans and Democrats on the committee for months. I mean, I know that seems like years as well, but in an attempt to develop a bipartisan health care reform bill. And he sought a wide range of ideas and tried to develop the best possible bill that could gain broad support of the Senate, and that's one of the problems. Now, this effort stands in marked contrast to what happened in the HELP Committee, where I serve as the ranking Republican. The Health, Education, Labor, and Pensions Committee majority staff drafted the bill with no apparent input from Republicans. The committee then voted down almost every single substantive Republican amendment to improve the bill on straight party line votes. As a result, the Health, Education, Labor, and Pension Committee finally reported a partisan bill that is loved by liberal pundits but has no chance of passing the Senate. And I think they realized that because they didn't even print the final version until almost the end of August so that anybody could even look at it. Chairman Baucus resisted the temptation to give in to the demands of the partisans and tried to develop a good bill that could gain the support of a large majority of the Senate. I've said for many months that health reform should have broad bipartisan support in order to gain the trust and support of the American people. Health care reform will affect the lives of every single American and have a dramatic impact on our economy and the future of our nation. It's too important to be passed by narrow partisan majorities. Unfortunately, the efforts of Chairman Baucus were ultimately unable to produce a bipartisan bill that could support, in large part because of arbitrary deadlines. We're here now because he was told that's all the time you get, and that was imposed by the Senate leadership and by the White House. Apparently, in some circles, there's a belief that passing a bill quickly is more important than getting it right. I regret that we ran out of time, and we weren't able to resolve several key issues that I believe must be addressed in any comprehensive reform package. I remain committed to working on a bipartisan health reform that addresses these issues. I will, however, continue to offer constructive ideas and hope that we still might have the opportunity to develop bipartisan solutions to address the health care challenges that are faced by our nation. Again, I thank the chairman for his indulgence, his effort, his focus, and his desire to get something done.
Thank you, Senator. Next is Senator Cornyn. He's not here, so I'll move to Senator